Hello, and welcome to OmniClinic. SmartSource OmniClinic is a network for patient, physician, and hospital communications. The network employs the most advanced and secure technologies available to display patient data on the web and on mobile communications devices such as iPhone, iPad, and Android-based devices. While working to meet meaningful use requirements, healthcare providers and organizations still lag behind other industries in leveraging the power of mobile medical communications. OmniClinic was designed by clinicians for clinicians with the purpose of helping to bridge that gap while filling important pieces of the meaningful use Stage 2 puzzle. The current version provides HIPAA-secure communications between healthcare providers, customized notifications for coordination of care, a patient visit and call scheduler for physicians, a pharmacopoeia of all complete FDA-approved drug monographs, and integration with any EHR. The existing OmniClinic capabilities help organizations meet meaningful use Stage 2 requirements in the interoperable records category, such as electronic referrals, coordination between providers, and ambulatory and hospital records integration. We are also building customized solutions to help organizations meet more of the Stage 2 requirements. Examples from the patient-generated data category include care experience surveys, symptom assessments, self-management diaries, and patient-generated data in EHR. OmniClinic frees important patient information that is locked away in EMR silos. Access to EMR data is achieved through custom integration with one or more EMRs. OmniClinic was specifically designed to provide an easy, uncluttered workflow that is intuitive and has no learning curve. Anyone who can use a smartphone can navigate the data they need in OmniClinic as soon as they're given a username and password. The following is a demonstration of OmniClinic's workflow. After login, the user enters a home screen from which the scheduling, messaging, and patient features can be accessed. The user can maintain a patient list or census. Patients can be searched across participating EMRs by using the search box at the top of the home screen. If data on any given patient can be obtained from more than one EMR, it is displayed separately so that the user knows which practice or hospital the data derived from. The scheduler is a feature of OmniClinic that allows a clinician to see his or her patient appointment schedule and call schedule in one place. The clinician can schedule or remove patients and add or remove on-call appointments. Any changes entered in the scheduler will update the host EMR if there is one. The call schedule has two main view modes, List View and Calendar View. By default, entering the scheduler positions the user over today's date in the list view. In order to maximize the use of screen real estate, the toolbars are hidden, but the user can scroll back and forth to reveal them. Tapping on any data in list view toggles over into calendar view, where a monthly calendar allows the user to navigate over larger spans of time. Days surrounded by a red box indicate call burden, whereas dates with a yellow background indicate that the doctor has patients scheduled for that day. Tapping the associated user icon will open a feature which allows the currently logged in user to see his or her colleague's appointment or call schedule, and even add or remove appointments for his associates. Another unique feature accessible through the home screen is the Messenger. The most important feature of the Messenger is that it is completely HIPAA compliant, as is the rest of OmniClinic. Data is encrypted both in rest and in transit. Users can only see their messages by logging into OmniClinic. The Messenger functions as a basic email application. By default, when entering the messenger from the home screen, the user is taken to the inbox, but other mailboxes can easily be accessed. The user can send messages containing patient data to his or her colleagues. The user can also attach notes and other items from the patient's record to messages and thus alert his or her colleagues of changes in the patient's status. For instance, a resident can forward a note to his attending and ask a question. A hospital physician can send a message to a PCP asking for more patient history or can forward a discharge summary. Let's select a practice site. The search field here will only search for patients who have data in that particular repository. When a patient is selected, the user enters the patient's main record. The record is structured as a simple menu tree. This has been kept as flat as possible to avoid an unnecessarily large number of clicks required to access a given data item. Of note, this menu tree is easily configurable per customer need. Items such as summaries and problem lists can easily be added or modified. At the top of the menu, a series of flag icons indicates important patient characteristics such as allergies, active isolation precautions, smoking status, pregnancy status, and code status. This information is displayed only if available in the host institution's electronic health record. Where not available or not applicable, the icons are grayed out. If information is available, the icon will light up in red. Clicking on the live icon will display the information. Below the flag icons is a slider that can add or remove the patient from the user's patient list. By selecting each menu item, vital signs and other physiologic values can be displayed. Transcribed notes can be read and forwarded. Lab results can be reviewed. In order to save time, the OmniClinic mobile app displays the latest available information first. Abnormal values appear in red. Critically abnormal values blink on screen. By selecting an item from the list, any other available results linked to the same sample or study are displayed. We believe that this cascading, interlinked way to browse lab results is uniquely suited to the use of mobile devices and provides the best way to numerically trend those values on smartphones. Contextual menu crosslinks aid in rapid data review. For example, from a list of cross-matched blood samples, the hemoglobin result history is directly accessible. The user does not need to leave the blood bank menu and enter the hematology submenu in the lab section in order to check the hemoglobin values. Future versions of OmniClinic will also allow for e-prescribing, order entry, and display of radiographic images and EKGs. Those features are subject to participation by host institutions and EHRs. The following placeholder images demonstrate the OmniClinic access page for radiographic images. The patient's latest known medication list can be viewed. Links to OmniClinic's pharmacopoeia of FDA-approved drug monographs are provided directly from the medication list. Admissions and demographics history is obtainable through OmniClinic. From OmniClinic, if using a smartphone, a provider whose telephone is listed can be called directly. ICD and CPT codes are also conveniently displayed in a separate menu item. This video demonstrates some of the important features of the OmniClinic network. For further information or for a live demonstration, please contact SmartSource LLC. This concludes the OmniClinic video presentation. Thank you for your attention.